So I was asked to share a few of my memories in an effort to give you a glimpse into what the last 2 years have been like for us. I always think it's best to start at the beginning. That first day, first semester. That January day, the then 40 of us sat in a room in Sequoia Hall, giddy with excitement. We first heard from Roseanne Lopez, who congratulated us and told us that we'd already done the hard part. We had gotten into a nursing program. All we had to do now was relax, work hard, and they would do the rest. They would make us nurses. Okay, the work hard part became apparent really fast, but the relax part, let's just say we're still waiting. Can we relax now, Ms. Lopez? We then heard from Jackie Keene. She spoke of things like care plans, prep sheets, and clinical records in APA style. What was she talking about? We found out quickly that those things she spoke of were to become the banes of our existence for the next 2 years. I don't know about the rest of my peers, but halfway through that day, I began to entertain thoughts of escape. How, I wondered, could I get out of this and still retain my dignity? Alas, I could come up with no viable option, and so I stayed. I remember the first time we worked with the mannequins in the skills lab. Let me tell you, we became 40 of the politest people you ever saw. After you, we'd say, "Oh, no, you first." No, really, I insist. You'd have thought those dummies had bubonic plague the way we were backing away from them. Jackie Keene had no choice but to part the wall of students and say, "You can't kill them, people." And so it began. For the next weeks, we practiced bed baths, vital signs, and transferring until our first clinical day arrived. We showed up at the hospital at 6 a.m. sharp in our clean pressed uniforms and our sparkly white uber-sensible shoes, ready for our first patient. After pre-conference, ever the encourager, Jackie, who, sensing the tension, looked at our anxious faces and said, "Okay, let's go up there and knock them dead, people." She made us laugh, broke the tension, and up the stairs we went. I leaned over to my clinical group and said, "Is she crazy? Does she not know we don't know what we're doing?" But a funny thing happened on the way into the room. We realized we did know what we were doing. You see, we were being taught well. Second semester brought the addition of OB, and for those of us who had not yet had the privilege of having kids, OB was a whole new world, and Susanna Machado was our fearless leader. With her gentle demeanor and clear passion for her craft, Susanna taught us about stations, contractions, and fetal heart rates, with great mnemonics like chicken-o and bull-he and veal chops. Now, they may not sound like much to you, but when you're taking an OB exam, they are a lifesaver. We practiced our postpartum assessments over and over again, and when it was my turn to do it in front of Susanna, I was ready, or so I thought. I went through my whole assessment, and when I was finished, I stood there and waited to hear my "good job." Silence. I waited a little longer. More silence. That could only mean one thing. I had forgotten something important. I looked at Susanna with a look that said, "No clue." And she looked at me and smiled, and looked at the patient and smiled and said, "So, how's your breastfeeding going?" Breast! That's it! That's what I forgot. I forgot to assess the breast. You see, Susanna knew that sometimes we nursing students just needed a little hint. We were being taught well. Third semester saw the addition of centralized trachs and pediatrics. On one occasion during our pediatric rotation, my 4-year-old patient's only medication was a simple saline flush. That's it. Just 3 tiny mLs flushed into his line to keep it open. Should have taken 30 seconds, maybe a minute. 7 minutes later, we're still there. Cara Potter sat patiently while I went and retrieved a second, third, and fourth flush. It's a long story, but believe it when I tell you that my thumbs got too big for my hands and everything that could go wrong did. You see, we nursing students, we got very nervous. Cara remained calm when inside I'm sure she was having the laugh of her life. When it was all over, I was certain I was going to be shown the door. You see, we nursing students are always certain we're going to be shown the door. But Cara assured me that even the most seasoned nurses have bad moments every now and again. You see, we were being taught well. Back to med-surg. Nancy Lynn had the job of delivering the heavy lectures that semester. And who could forget her lecture on blood gases? Best thing ever. We walked in there completely confused, and we walked out, we got it. I mean, we really got it. To the point where we were asking for blood gas questions to be on the final. Who does that? We do. Because we were being taught well. Back to the med-surg floor for a third time. And I remember one evening a patient needed a flu shot, and our clinical instructor, Rachel, asked if there was anyone who hadn't given an IM injection yet. I eagerly volunteered, and we walked over to the Pyxis to pull the medication, and Rachel said, "Just a moment, a few questions." Really? Is there ever going to come a time where we can do something fun without getting grilled first? "What size needle are you going to use?" she asked. Well, at that moment, everything I knew about needles went out my ear, ran down my arm, and landed on the floor. I pulled a number out of thin air. 20, I said. Well, anyone here in the health profession knows that to give a vaccination with a 20-gauge needle is kind of like squirting a flea with a fire hose. At that point, Rachel could have said a lot of things. None of them kind, all of them deserved. Instead, she said just one word. Ow! Too big, I said. Yep, she replied. Go find the answer and come back. Really? You mean you're not just going to give me the answer? Of course not. And I have never forgotten a needle size since. We were being taught well. Fourth and final semester, Sue Wexel and Barbara Tisdale introduced us into the world of mental health with the respect and dignity that it deserved, and ushered us into our first psychiatric facility. Kind of felt a little like they were letting the foxes loose in the henhouse. Within a few weeks, thanks to their many informative lectures, we had diagnosed each other with all kinds of personality disorders and anxiety disorders. Unless you feel left out, dear family and friends, we diagnosed you too. And remember, we were being taught well. Back to med-surg one last time. One last time learning a whole new charting system. One last time caring for a patient who, despite our best efforts, insisted on spending the entire shift naked. One last time being paired with a nurse who'd rather not have us around, but could find us like we had a GPS on the bottom of our shoe if her patient needed an enema or a suppository. Which brings us to today. I would like to direct the last minute directly to my classmates, if I may. If I can. The last 2 years have probably been the most challenging years of my life. But I cannot imagine sharing it with any other group of people. 2 years ago, we were a disparate group of random people thrown together by a desire to care for others. And today, we are a cohesive group, united as nurses, actually capable of doing just that. You are some of the kindest, funniest, nicest people I know. And I, for one, am a better person for having spent this time with you. I didn't get to know all of you well, but of all of you, I know this. It took great courage for you to embark on this crazy odyssey. You made great sacrifices to get here. Know this. If you had what it took to get through this program, then you have what it takes to do anything you set your minds to. As we turn the page on this chapter of our life, in anticipation of the next, we can go forward with confidence, knowing that we have been taught well. Thank you. you guys please remain standing. I present to you Evergreen Valley College Nursing Program Class of Fall 2012. Let's give them a round of applause. We would ask that you remain seated while the graduates exit the building. Or you don't have to stay seated, but just